Family members, I mean, it's just human nature to get upset when your loved one who's clearly sick, everybody can see it when they won't admit it. And you do talk a lot about,
Look at
uh,
your language. You said won't admit it. I love that.
yeah,
Like it's purposeful. And that's how I was with Henry. It's
right.
purposeful. Admit it. I know you know that you're ill. Just admit it. Sorry, go
Just
ahead.
admit it. No, you're right. It's the way we think about it. Like you point out, and we go through it all. We think they're in denial, they're being difficult.
Refusing to admit. I used to say that.
Yeah.
Anyway,
Yeah. But your research showed that poor insight is actually a symptom of their illness, which completely changes everything. It's not under their control.
we never tell somebody to stop hallucinating, would we? Just cut it out. Stop hallucinating. But with this poor insight, which has a tongue twister of a name, it's called anosognosia. I didn't come up with the term. It was a neurologist in 1919 who described people who, for example, were paralyzed on one side of their body, neurological patients, and didn't know it. It's a symptom of the illness. It's a neurocognitive deficit. It's not my brother being difficult or patients I work with, difficult or stubborn or selfish, refusing to admit something. They truly don't understand, don't see it.
Right. And you also point out that if you don't believe you're sick, it's perfectly logical to refuse psychiatric drugs.
Yeah, it's common sense. I mean, would you inject yourself with insulin if you didn't have diabetes?
Yeah, absolutely not.
Crazy. And that's what it's like for about 6 million Americans with serious mental illness who have anosognosia, who don't understand they're ill. It is absolutely illogical, if not kind of crazy, to accept these powerful psychiatric medications when there's nothing wrong with me.
Yeah, and one thing you said, you went through this common experience that so many people with who have a loved one with an illness like this go through, where you're trying over and over and over to just get them to see what you see. And you quoted the Albert Einstein definition of insanity.
Right. Yeah, I do this with families all the time who are really frustrated. And I said, and I'll ask the parents, how many times have you tried to convince your son, and for how many years, that he's mentally ill? 10 years, 5 years, 2 years, 15 years. And then I'll ask them, is it working? They say no. Then I'll say, you're the insane one. If you think it's Einstein's definition of insanity, doing the same thing over and over and over again and expecting a different result. And that frees people up, actually, when I joke around with them about it, because it's like, you're right. Why do I keep doing this?
The other thing that struck me looking at the research that you're pointing out is that anosognosia is so tied to a lot of poor outcomes.
Yeah.
And it's one reason why you say, as a family member, it's very easy if you have a loved one who doesn't want help and they're hostile to it and to you, to kind of back off and just let it go. And you say for a lot of reasons it's a bad idea.
But
So then there you are as a family member. First of all, can you kind of talk more about why you can't just leave it alone?
well, I mean, when people have anosognosia, their quality of life, their psychosocial functioning, their ability to work, to go back to school, to have relationships, to not, the illness isolates people so much. All of those things worsen, and letting somebody. I mean, there's other research that untreated psychosis can be actually toxic to the brain. So letting someone, and it's a weird way to say it. It's not that we let people, but not staying engaged and trying to help and allowing untreated psychosis to continue for years is really tragic. It results in all kinds of negative outcomes for the person, including the possibility that the brain is suffering. It's toxic to the brain to be psychotic for 2 years, 5 years, 10 years.